Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this edition of the American Health Journal. Liposuction has turned high-tech with the Vaser body sculpting procedure. It's the latest form of ultrasonic liposuction that shakes and melts the fat for easier extraction. Dr. Payman Simoni of Simoni Plastic Surgery in Beverly Hills, California, explains how he uses this new procedure.
Vaser is the latest form of ultrasonic machine. Ultrasonic waves are the same waves than when we have a pregnant woman and we want to look at the fetus. That wave are being used to shake the fat cells, and when the fat cells shake, and the reason it's only shake the fat cells is because they have a lot of water, and ultrasonic waves works very well in the water type situation. The muscles and blood vessels, they don't have as much as water. They are very condensed, so they don't affect as much with Vaser. So what will happen is that the fat cells start shaking and they burst open, and when we suction it out, we suction the fat out without pushing so much into the fat tissue. The way I perform it is without anesthesia. I like to take one step back. What would be the wish of a person? If you ask a person that you have this fat pad on your body that you can't get rid of with exercise, what would be the wish list? A person would say, I like to go in without having any discomfort, have the fat pad liposuction. I don't want to go under anesthesia. I want to go back to work in a couple of days, and I want to see a result right away. That's the wish list for a person. Let's see how much of these wish lists are available out there. There's a lot of people that bank on this wish list, but they don't give all of it, meaning that they will say, oh, absolutely, we're going to take care of the fat without anesthesia. We're going to do it in the office, and you're going to go back and work the next day or the next day after that. But the part that they don't tell them is that either we cannot get rid of all the fat, or we just have to do a little bit, or what we do is not FDA approved. They do it with injections. Sometimes they do it with a little bit of a laser, which is not Vaser. I want to make sure that this is two different. People kind of confuse laser and Vaser is different. The problem with those is that people got everything on the wish list except getting rid of the fat part. What I do is I try to get everything on that wish list. When I do a procedure with Vaser, when I do a tumescent liposuction with Vaser, the patient is wide awake. They don't feel anything. They talk on the phone during the whole time. They get up, they stand up, and I do a liposuction then, because then I can see the body, I can sculpt it very well. They see the result right away, because I take the fat right away. It's not like I'm injecting something into the fat and say, well, come back in 10 times and let's maybe see some change. No, we take the fat out right there and right then. And then the patient goes back to work in a day or two after that, because we don't create a lot of trauma to the body. And we have everything on the wish list now.
We asked Dr. Simoni who is a good candidate for this procedure.
A good candidate for any liposuction is a good candidate for Vaser. Let's see who's good for liposuction. Somebody who eats well. They do exercise, because liposuction does not replace a good nutrition and a good exercise. So people who cannot lose areas using the exercise and a good nutrition, that's where the liposuction comes in. So any patient that is a good candidate for just any type of a traditional liposuction is great for Vaser, especially for people who has done liposuction before. Because when you do a liposuction, you create a scarring. And people who have problems with liposuction because of the unevenness, now we have Vaser, it makes it much easier to get into these hard-reach areas.
You're watching the award-winning American Health Journal.